There are so many cases where most of these effects can be able to get seen in individuals, in most cases adults, and having these control measures or having these measures getting put in place can be able to really control much of what you have actually discussed here as the symptoms or the effects of the overproduction of thyroxine hormone by the thyroid gland. And I have actually been able to come up with a brief description of how the eye and the ear works well in terms of hearing or perception of sound, and how the eye can as well be able to perceive objects in the environment. So please, let's catch up in our next video. And before I can just be able to close this, you'd also understand that the overproduction of thyroxine hormone or hyperthyroidism or oversecretion has been associated with a condition called thyrotoxicosis. Thyrotoxicosis is a condition where the heart fails when there is overproduction of thyroxine hormone by the thyroid gland. So in most cases, if a patient finds himself or herself in the hospital and tends to actually get taken there with a related condition of hyperthyroidism, the doctor can actually first monitor the condition of the heart. And if the heart has a failure or there's a condition called thyrotoxicosis, then that means the individual has a high chance of having hyperthyroidism or oversecretion of thyroxine. There is nothing as dangerous as your heart failing, and that is what we call thyrotoxicosis. And of course, you have actually been able to get to some of the ways in which the heart can fail as well under what we call the circulatory system. We have what we call the coronary thrombosis, we have what we call cerebral thrombosis, we have what we call arteriosclerosis, we have what we call the varicose veins, and hypertension or high blood pressure. And of course, when the heart fails, then you're normal. That means that's the end of your life in most cases, depending on the extent of the damage that has actually been able to get done on the heart. Remember that just like the way we talked about the causes of hypothyroidism, hyperthyroidism is also caused by what we call defective enzymatic actions or plasma proteins that stimulate the thyroid gland to overproduce thyroxine hormone. So you have certain plasma proteins found in the blood that can stimulate the thyroid gland to overproduce thyroxine hormone, translating what we call hyperthyroidism or over secretion. Thank you so much for your listening.